Hey guys, Dr. Ashley Mack here. I just wanted to take a moment to let you know why I haven't been able to post an episode in a long time. Everything has been fine, but I am an in-person physical therapist out here in Marin County, California. And that business has really taken off and it's taken my attention away from creating more of the virtual content. Now, moving forward, I'm actually going to be rebranding this podcast as a functional rehab podcast. It's going to expand a little bit more into the other facets of recovery, which includes sciatica pain, but also can cover knee pain, arthritis, and what we have in this most upcoming episode, osteoporosis. And so I hope you stay along for the ride. It's been an honor being able to grow this podcast and really excited for the next phase of this chapter. And without further ado, let's get started.
This is the Functional Rehab Podcast with your host, Dr. Ashley Mack.
All right, and here we are. We're back. It's been a long time since I've recorded a podcast, but one of the most important things, especially this day and age, and you probably see it across media, is actually the importance of resistance and exercise and its role with managing osteoporosis. And rather than having you listeners just hear me talk all day, I have one of the leading experts in osteoporosis and women's health. And she's a very special guest because she was the one who caught our daughter. And I've been forever grateful. And so today we have Dr. Lizellen LaFollette, who is an OBGYN as well as a women's longevity expert. And she has a wealth of knowledge amongst this space. So Lizellen, Dr. LaFollette, it was so great to see you again. Thank you so much for being on today's episode.
Thrilled to be here as always, Ashley.
And so for the listeners who are coming on being like, I have heard this term osteoporosis, maybe I'm getting a little bit older, I'm starting to get a little bit scared because people that I care about are experiencing osteoporosis. Can you walk us through what osteoporosis is and the process as to how someone can get to that point?
Yes. All right. So let's just talk about bone and let's talk about what happens to bone over time. So there's two processes that everybody has to remember. One, bone is built and laid down in adolescence, somewhere between teenagers and maybe let's call 25. Maybe it's as long as 30, right? So that's what has happened to your bone, and that's as good as it gets. By the time you're 30, it's probably the best bone you're going to get. In menopause, with loss of hormones, we know that many women will lose as much as 10% of their bone in the 5 years, 2% a year of the 5 years of menopause and perimenopause. And that the recommendation, which was, of course, the USTFPF recommendation, is get a bone density at 65. Okay, everybody, 65 is 15 years after menopause. And if you know you're losing bone at menopause, we need a bone density long before that. So as I started to learn about longevity, and to call me an expert on this, let me say I learn every day. So I am becoming more knowledgeable, but I wouldn't say that I am an expert, although I'm going to darn well try to make sure everybody understands this particular pathophysiology of decline in terms of bone. We really have to understand that at menopause, you're starting to lose bone. Now, let's just think about what makes good bone. You have this dynamism between the osteoblasts, I call them the builders, easy to remember, blast and builders, and osteoclasts, which are the chewers, and they compete during the entire time you're putting bone down. And at menopause, for some reason, the blasts go to sleep. So your class, which are the chewers, continue to remodel, and nobody's building anything. So guess what? You lose bone. So this dynamism of two factors of your bone, the blast and the class, has to be addressed, and we need to understand how to build bone back. And there's going to be more than one way. Some of them involve drugs, but a lot of it involves exercise, training, and weights. So that's where you come in, Ashley.
And so let's talk a little bit more about, all right, so here we are. We're given this diagnosis of osteoporosis. We know that the bone density has gone down. This might sound like a really silly question, but like, why is this such a big deal?
Right. All right. So here's the negative. Of women die of heart disease 7 times more commonly than cancer. And the other way women die is hip fracture. 25% of women who have a hip fracture never get it out of the hospital. So a hip fracture is directly related to bone loss. The second cause of morbidity in women have to do with the curvature of the spine and vertebral fractures, because that's the other place where you lose bone. So it's, both your spine and your hip. hip fractures people know about. Vertebral fractures are painful, and the curvature of the bone related to the spine losing, columnar height because of the vertebral body is compressing. One of the things we understand is that actually pushes you forward, the neck comes forward, swallowing becomes difficult, and there's all sorts of mechanical problems related to that posture and that shape. And we really want to avoid that. And we know from years back that if you take every woman who's 80 and put 1-pound brick in a backpack, you will be able to correct some of that curvature. So some of these mechanisms don't have to be complicated, but we want to continue to maintain posture and maintain, to the best of our ability, vertebral body height.
Absolutely. And thank you so much for bringing that up. And so visually speaking, especially when it comes to vertebral body height, here we are in the San Francisco Bay Area. You walk through Chinatown, for example, and you're seeing all these old Chinese ladies bent over, curved, and I think you probably seen it. There's a large osteoporosis prevalence in the Asian community just because the foods that we eat from a cultural standpoint doesn't contain a lot of that calcium and that vitamin D, which is like necessary for that bone health. And so let's talk about the other end of the spectrum, right? Because it's like we're looking at bone loss that happens or at the start of menopause, and it does certainly get accelerated when someone isn't physically active. So on the other end of the spectrum, where you have these women who are physically active, Pilates, yoga, they do exercise, right? They're cardiovascularly fit, but all of a sudden they go to your office, right? And at 50 years old, they take a bone scan, all of a sudden, oh my goodness, I'm a couple standard deviations away from normal. So what are some of the reasons as to why that could happen?
All right, so a couple things. Let's go back to the Asian population, though. That is an important population to talk about because if you look at the Asian frame anyway, the bone isn't that particularly, as robust as perhaps the white population. So start with different bone to begin with. But there are three things that we know in that population. Number one, as you can tell from Chinatown, many people are living in their 80s and 100s in that population because they move, they're walking, they're taking their groceries, they know where they're going in an area that is very confined in a safe way. Secondly, they never really had terrific bone because they certainly weren't doing gymnastics and weightlifting and swimming, all the stuff that you were doing as a kid, right? So they weren't necessarily doing that because that wasn't culturally okay or recommended or pushed. All right. And three, they are at highest risk because they don't start out with a great matrix. So this idea that we can fix our matrix is, the caveat is, it would be really great to know that you put down the matrix when you were a teenager, right? But that ship for most people has lost. So what do we do about it? So first of all, get a bone density earlier. Get it in your late 40s, get it in your 50s. Find out where you are. Now let me say, Ashley, and you know this, there are many women that I find that either have osteoporosis or osteopenia. So what do we know about bone? We know that bone is stable, and then we know for women anyway that menopause becomes this slope that goes down pretty steeply. So if we could avoid that slope, men don't get into trouble with their bone typically until they're much, much older. So let us try to just get to that same curve. If you're gonna try to keep your bone good, keep it good 60s, 70s, 80s, 90s, and that would make everybody certainly live better and longer in terms of bone health. But what's it going to take to do that? All right. So first of all, recognition of the problem. All right. Get a baseline bone density. Now, here's the insurance problem. An awful lot of insurance problems are saying, well, what the heck are you getting a bone density for? The recommendation by the USTFPF is 65. And my push to anybody that's in any kind of governmental position is change that recommendation yesterday. Because it doesn't help anybody. I cannot fix somebody at 65. I can, but not as easily as I can if they're in their 50s. So let's just assume that in your late 50s and or late 40s, early 50s, you have a bone density that says osteopenia. Okay, then we get into the sort of maximizing what you can do. 1, exercise. 2, lift weights. 3, vitamin D and calcium. Now remember that vitamin D and calcium are the building blocks, right? They're the substrates. They're the stuff that bone needs to be able to put bone down. So you're really just like feeding your bone with those two, right? They're not changing the class blast balance, but those are the things that'll make a difference on that, just to make sure you get enough substrate, right? But many women, and this is really a problem, I think, culturally, as well as the stigma of gyms, have never lifted, and they don't even know how to lift, and they don't know how to lift to protect themselves, in addition to gaining both muscle, tendon strength, and then indirectly bone strength. So all of those things come together, and that's where you really need to help them with the education.
And I'm so glad that you are spreading word and sharing that it is important to be able to load our joints and our bones. I think it was, one of the observations I've made from my end point is that there was a paradigm shift in approaching the exercise and resistance training. I think it was, from my perspective, it's only changed maybe in the past 5 to 10 years, where it transitioned from, and I remember even in school, it's like, okay, osteoporosis, high risk of fractures. Okay, you're going to add some resistance training, but it's going to be light resistance training, Tai Chi and yoga. But here we are now, right? And saying it is important to lift weights. And so for me, I've observed it's only happened in the past 5, maybe 10 years. What have you observed in that paradigm shift?
Well, I think the problem with women is they always were focused on how they looked and what their weight was. And that needs to pivot into strength. Right? We will live better if we are strong. Now, if you look around a typical gym, especially around the weight section, right? The free weight section I'm talking about, it's not usually women that are in front of that mirror lifting, and they're not grunting and dropping the weights and, spraying whatever, in a typical thing. We try to go as far away from that particular scene as we can. But that doesn't work. We have to stop avoiding it, but we have to do it safely. And then we have to be consistent. It's not just safe. It needs to be consistent and safe.
Yes. And so let's get down into the real meat and potatoes of today, which is, let's talk about the exercise concepts themselves. And so we're transitioning from lighter resistance to heavier resistance. And so listeners, the concept of resistance is adding what I like to call an external load. So it is going to be a weight. It could be a weighted backpack. It could be a dumbbell. It could be a barbell. It could be even your child, especially if your child is getting a little bit bigger. And what I found, especially over the past 5 to 10 years, when I'm starting to see more clients with osteoporosis, is the fact that when we load up their structures, we experience a couple different, very positive changes. Number one, the easiest part is from a cardiovascular standpoint. And you're absolutely right. From a cultural shift, there was this big concept of high intensity interval training is very important. It's very important, especially from a cardiovascular standpoint. But in some cases, we've over-indexed on that standpoint, because here women are having like really great cardiovascular bases, but then also they're looking at their bone density saying, oh my goodness, I'm a couple standard deviations, I'm osteopenic or osteoporotic. And so I'm going to backtrack. What's really interesting is okay, we all have 24 hours in the day, right? How do we fit our low intensity aerobic training, our high intensity interval training, and how do we fit in the weightlifting or the resistance training into our busy schedules? And so I have an idea, but for a lot of the patients that come into your office, because you're usually the first line of defense, right? They come in for a checkup and they're like, oh my goodness. When they say how do I fit this in? And I'm already in a really busy structure, outside of working with someone like me, which I'll have some strategies, but yeah, how would people fit this in?
So that, remember, it's Ashley, it's such an important question. It's how do we, it doesn't work if I tell people they need to lift weights and I don't give them you to actually help them do it right. Right? You have to have a team together. It's too hard. People try to do the right thing and then 2 days later they forget. So if you couch it in the terms of your bone loss at this point can either be stabilized or improved with resistance training. And if you don't, you will most likely continue to lose. Now, what is the answer I get back? But I'm doing Pilates, but I'm doing this, but I'm running, but I'm walking the dog. I'm like, what are you doing to load your upper back, to load your shoulders, to load your bicep? What are you doing for your upper body? And particularly women, it's literally waist up that they don't think about in terms of, are you planking? Are you, things that are really important, that whatever they are doing, they're all fine. But the reality is it's not fine enough to get bone back. So my line is keep doing all the stuff you're doing. You've still lost bone. If you've lost bone, we need a different plan to get bone back.
Absolutely. And which means that, and especially at the menopausal age, what's interesting is that this is a very significant time in life because you are trapped between two major generations. Your parents are getting older and your kids are getting older, and being able to like having to manage the two. You're caught in the middle and you're the one who has to navigate all this, right? And so you're already having this invisible backpack on your shoulders. Now, let's start off with frequency. I'm a huge fan, and especially now that I'm a parent of a toddler, I understand that although we all have the same 24 hours in the day, like we have responsibilities, right? And so how do we fit this in? The reality is the fact that if we can add in two 30-minute resistance training sessions a week, that is pretty much all you need. And what that means is because we are training only twice a week, we have to be very purposeful with what we do. And I think when especially women or like people in general, when they're like going to add something new, they think they need to do it 3 or 4 times a week or even 5 times a week. And the truth is that if you have the time, sure, you can. But the idea is that the more times you train in a week, the lower intensity it has to be in order for you to not over fatigue, which is why I find a 2 days a week plan at 30 minutes. It gives you the opportunity to train hard, but also enough time to recover as well. So then we go from two 30-minute blocks a week. And then from there, we add in from a specific exercise standpoint. So the most important exercises, and there's the Lift More trial that actually talked about some very, very important exercises. Like number one, it was squatting with load, let's backtrack.
Squatting with load, geez. I mean, my gosh, Ashley, what did that right there? You've lost half the women in the room.
Yeah. But let's talk about real quick, DEXA scan real quick. The three or four areas that we look at. Tell us about those specific areas and we'll translate over.
Exactly. So the DEXA scan, and let me just say that the gold standard in medicine anyway, so far, for bone loss measurements are a DEXA scan, which is literally a device you sit in and it scans your spine and it scans your hips. It can also scan your wrists. I try to do spine and hip because that's the one we've seen the most, but you know darn well that many women actually break their wrists kind of as one of the first things that goes. And anybody that's had a fracture that is in the 45 range or whatever, they all need a bone density because they've already broken a bone, so we don't know what's happening on that front. So the DEXA scan is really looking at the composition of bone that you have at that particular time in your life in terms of the standard deviation from, of course, a white population. So one could ask the question, if I'm comparing an Asian woman to the white population, we know darn well their bone isn't the same. All right, fair enough. But we also know that Asian women have osteoporosis a lot, and we need to pay attention. And part of that has to do with just understanding population. So in the best of all worlds, Ashley, we would have a DEXA scan for each population, but we don't. Maybe we will with AI. I don't know, but we should. So that's where we start. So it's not perfect, but it is our sort of baseline gold standard. The standard, is interesting enough, used to be that the hips were worse and the spine came later. I'm not sure I'm seeing that actually, Ashley. I don't know what you think about that. I'm thinking, maybe all that running did actually help their hips a little bit longer than it did their spine. But I have a sister on each side, and both of them are osteoporotic, and I have normal bone. And one's 16 months older, and one's 11 months younger. So go figure, right? Yes, I've lifted. Yes, I've always exercised. That was the way I could protect myself because I wasn't really sleeping delivering babies. But the reality is that we shouldn't have that much standard deviation from a genetically similar group.
Absolutely. And so going off of that, right, hips, spine, and wrist, let's talk about squatting. Squatting, for you listeners, it's getting on and off a toilet, in and out of a chair. But when I say adding external load, that's actually when you're going to be adding weight. And the question is, well, how much weight should I be adding? It should be actually, what I find is to kind of figure out the gauge is identifying, well, what are you lifting on a daily basis? If you have a tiny dog who's 12 to 15 pounds and you have to pick up after that dog, you can certainly lift more than 15 pounds. And so if you're doing your exercises and you're looking, well, I typically pick up my 15-pound dog, but I have 3-pound weights. That is a signal that gives you permission and tells you that you should be increasing your weight. And What's really interesting is the fact that squatting is particularly important because it loads up our entire system. When you're holding a weight against your body, you're loading up your spine. If you're holding the weight in your hands, you're also loading up your wrists. You're also loading up your hips as well. So you
Nice.
have that specifically. What's interesting is that you'll have a lot of orthopedists who say like, well, squats aren't going to be that great for the knees. I would say that my answer to that is if you're squatting improperly, that's when you can start developing a whole bunch of arthritis, which can be a completely different conversation from an arthritis standpoint. But the trade-off or the idea is the fact that if we load everything up correctly, we can stave away arthritis, we can minimize your joint pain while also building up your bone density. And what's particularly great is when you're doing an exercise like a squat, it's multi-joint, which means that you train many muscle groups at the same time. So talking about bang for your buck in regards to time invested, you can get a lot accomplished with a heavy set of squats more than, say, doing a whole bunch of lightweight squats. Now, I think lightweight bodyweight squats are very good from a cardiovascular and a just movement standpoint. But again, in the cases of bone density, it's important for us to be able to load up the squat. The second part of it, or the second most important lower body exercise, is what I like to call deadlifts. And deadlifts is simply picking things up from the floor and then just standing up. You don't have to lift it up to your shoulders. It's literally going from the floor to your hips. And it's just like if you're picking a baby up off the floor, even just picking up a bag of groceries. And so the gauge on how much should you be lifting when it comes to deadlifting, it should certainly be heavier than the typical bag of groceries that you've been carrying. Again, when you can look at the weights or the weight of the objects that you're picking up on a daily basis, that should be your minimum. It's either it could be your minimum or your warm-up.
Nice.
Right? Yeah, your minimum or your,
right.
and then the third I think most important exercise is actually going to be a push-up variation or a press variation. So it is important, and if you're looking at a push-up, if you can't quite do push-ups yet, that's totally fine. Another option is actually what I like to do call an elevated push-up. So you're going to be doing a push-up from a countertop and gives you the opportunity to really load your shoulders. And I find, just like many other people that I work with from an injury standpoint, we get hurt during exercise, not because the exercise and the load is problematic. It's really more how we execute the actual exercise. So a large part is form, which is why it's so important to either follow an accredited set of instructions or working with someone like me who will actually walk you through this step by step, right?
And record it. I mean, one of the things you were very good about doing, Ashley, is to record it. I mean, we don't know what we're doing right or wrong if somebody isn't actually watching us do it, especially as we learn. And it's all fine and dandy for everybody to be doing Pilates and all this other stuff. But if you are in the process of assessing your bone, we know whatever you've done up until now has not done it in terms of preserving bone. So now you need to add new things. You add new things. You need to do it in a way that is safe, and that somebody's watching you, and that you understand how to do it. How many times does it take to understand something? Enough that you can feel that the posture and the way you do it feels right. And then you have a sense of actually you've now absorbed this as a habit. But again, this is so important to learn this right, because the fastest way somebody will get in and out of a gym is doing it wrong, hurting themselves, and then they're never going back.
100%. And especially as we get older, it takes a little bit longer for us to recover from those tweaks and those things that occur. You know, if you look back when you're 16, 18 years old, you scrape your elbow against something, 2 days later, you're fully healed. When we get into our 40s and 50s, it does take a little bit longer for us to recover from those activities. And especially if you're doing something completely new, it can be really scary. Right. And so being able to introduce that in a way that's lower threshold, I think it's going to be important. So we talked about how important it is to add resistance.
Yes.
One thing I actually really appreciated that this Lift More trial and actually started to become a little bit more present is this concept of impact training. And so the idea of, in essence, impact is being able to apply force, but at a fast pace. So something like running is a high impact activity, walking is a low impact activity, just because of how quickly you actually make contact with the ground. And so what's really interesting is impact is also going to stimulate bone. I like to say that bone is one of the most perfect building materials, because if you stress bone out, it actually makes it stronger. Compared to every other building material, you take two pieces of wood, you rub them together, they're going to wear away, but you take two bones and you rub them together, they're going to grow. And so the idea of adding impact is going to be really important. Now, here we are, 40s and 50s, perimenopause, menopause, postmenopausal. It's like, well, how do we incorporate some impact? Maybe at this stage you've had some children and maybe your pelvic floor isn't quite ready to take on the load, right? Maybe you have a little bit of leakage when you jump. Well, certainly number one, if you have leakage when you're doing any sort of stress or strain, I actually highly recommend that you speak with a pelvic floor physical therapist. I'm not a pelvic floor therapist. I've definitely worked in the postpartum realm and I can do a lot of things, but if you're experiencing some true leakage and some stress incontinence, definitely an opportunity to be able to look into those specialized pelvic floor physical therapists. They are very few and far between, but they are amazing at what they do. But other alternatives to, say, just like jumping off the ground is what I like to call, or you've seen is kind of just, I call them step offs, where you're stepping off maybe a 3 to a 6 inch block and you're catching yourself on the ground. And so that allows you to absorb the load at a high pace, which continues to stimulate bone growth. And what was really interesting is that you combine all these exercises, and what I've observed is the fact that the exercise science for this population is actually consistent across all populations, because we're looking at trying to do lower repetition, usually between 4 and 8 repetitions at a higher intensity. So we're looking between 7 to 9. You don't have to max out your weights, but you certainly should be experiencing some fatigue.
Yes.
Not necessarily like a muscle burn, but more, I call it like a neurogenic fatigue, where you're like, oh, I don't know if I can do another rep, but I'm not feeling quite exhausted. And what's really interesting is that just to forewarn you, for those listeners who are really into like the high intensity aerobic stuff, is that it's gonna be moving a little bit slower. You're gonna be noticing that maybe your heart rate doesn't get as high, but you're going to notice that maybe about 20 minutes in, your body's really warm. You might be breathing a little bit heavier, but you're not experiencing that like cardio burst that you're used to. And that is 100% normal. And that is what it should be. Because if your heart rate is that high, that means you're lifting too little weight. And that, although it's good for your cardiovascular system, it is not necessarily adding much to your bone density part of it.
And I think we do have to balance, right? We have to balance the cardiovascular. Most people are aware that, look, we all need, this goal of 10,000 steps versus 7,500 steps, whatever. Walking is a lot, and it can absolutely prolong lives. Running can also, but a lot of people have trouble in terms of loading joints over time, so they have to be careful on the surface in which they are running and the time at which they run. But then when you're talking about trying to build bone back and get resistance training, that has to be part of it. So in a typical week, if you think about the goal of 150 minutes in a week of moderate intensity, the reality is that you still need to think about that or I would say as a baseline, and then add the resistance training on there. So you really have to think about doing something 5 days a week and maybe more. And it doesn't have to be 2 hours, but it does have to be somewhere in the vicinity of 20 to 30 minutes. And it's either 20 minutes 3 times a week or 30 minutes twice a week, ballpark, to be able to make it that works with your schedule. Because the way habits are solidified is you're adding it to something you're already doing, and that is more likely to make that habit stick, right? So we need to understand what is realistic for you and incorporate that as we go forward. Now, there's a lot of new technologies in this field, so I want to talk a little bit about, there's a belt called the Osteoprosis, started by somebody, I think, down in Silicon Valley. It's literally a belt that vibrates, that you wear for an hour a day. Their studies are teeny. The belt itself costs $1,000. So both of those are a little bit pricey in my mind and a little bit circumspect. But the reality is that that's something that some people can try if they want to actually help. The weighted vest people talk about, and Ashley, you may know this better. My understanding of the weighted vest is you're going to have to wear it pretty much 8 hours a day for it to make a difference in terms of your bone. So, maybe it feels great to have a weighted vest, but I don't think it does as much as what it appears to, and it certainly has been a very big fad.
It certainly has risen in popularity. I think it's a multi-layered aspect, because I think realistically speaking, wearing a weighted vest 8 hours a day is going to be really tough, but it's actually a really great way for folks to actually add some resistance on top of the things that they're already doing. So I think it's more of a, how would I describe it? I wouldn't call it a meat and potato scenario. It would actually be more of a side,
Okay,
which
nice.
the reality is that if you add a whole bunch of sides together, you technically have a complete meal, right? And so
Yeah.
if you combine that, you should be in a good spot. But really, again, like yeah, for sure, like the meat and potatoes are going to be the heavy resistance training, and you're absolutely right. It's being able to, I like to call it. I'm also at this stage in my life where we don't necessarily need to make things hard and miserable, because whoever wants to do that, right? And so no one has time to do things that aren't fun or aren't enjoyable. And so if you find that going to the gym and lifting weights is actually very stressful, or even just the thought of going to a gym makes you get into a cold sweat, it might be a perfect opportunity to actually work with a professional to be able to say, I need help with this. And a client of mine actually said to me, Ashley, I tell people what to do on a daily basis, and I really appreciate when you tell me what I need to do. And so, and you look at it this way, especially, here you are in your 40s, 50s, or 60s, like you are the manager. You're the head of the household when it comes to how things work, your kids' schedules, your parents' schedules, your parents' doctor's visits, and also your job itself might be a great opportunity for you to be able to just be told what to do. So let's talk about starting off points, right? And so there's a lot of different things out there. I know locally, if you just search osteoporosis, like strength programs, you'll probably find some in your local area. You'll also probably find some apps, which is a great thing. I actually have an ebook that I will put a link in the show notes for you to be able to actually have. It's a free 12-week program that you can just follow through on your own. But again, if you need help, work with a professional like myself or with the other people in your area, asking them if they are actually well versed or understand the concepts of osteoporosis. Which also reminds me, when you are osteoporotic, there are a couple of things that you do want to avoid. What you're going to want to avoid is actually any high repetition flexion based movements. So this stuff like where you're doing prolonged and high intensity child's pose positions. I know a lot of folks who are osteoporotic and love yoga, but that's something that you would want to avoid just because of that risk of compression fracture. You would also want to avoid sit-ups, and then you would also want to avoid things like leg raises too. There's a lot of ways for you to actually train your core if you want to build up your core. Hence, actually, when you add resistance to all of your lifts, your core will be trained. So keep that in mind. And then, Lizellen, when they're people are in your office, right? Or when they're in their doctor's office, they're going over their DEXA scan results. They're like, oh my goodness, okay, this kind of sounds like a death sentence, but it certainly isn't, right? What are some of the easiest action steps that the listeners can take once they get that realization?
I mean, I think number one is, okay, this is one point in time of your scan. How is your vitamin D? How is your calcium intake? What are you doing for your skeletal health? And then there's two categories of medicines that can make a difference. And I'm going to put them in two different categories. One is anabolic medicines that'll build bone back. The others are anti-resorptive, which basically slow down the class, the chewers, right? So if you think about these two types of medicines, and I'll explain to you quickly, and there's a lot of detail on here, so if it gets too technical, stop me, Ashley. But the recommendation of the anti-resorptives, right? And there are, 5 of them, and I'll give you, Fosamax, Alendronate are the easy ones. Prolia is another one. Hormone replacement therapy is one. By the way, they are literally slowing down those osteoclasts from chewing up your bone. Okay? So that's a lovely thing. They're stopping the remodelers. But if you think about it, that's not building bone back. That's just freezing you and where you are. So although the anti-resorptives got a very big push in the last 15 years, the reality is that we've learned over time that after 5 years, there can be some jaw necrosis, there can be some femur fractures. So it's not something you want to be on forever. So that gets into the question of how do we build bone back, which is the anabolics. So how do they work? And the categories of medicines are Tymlos, Forteo, and Evenity. Those are the 3 that most people have heard of. And if you think about it, the ways you can measure your osteoclasts and your osteoblasts are actually, there are some blood test markers that you can look at. P1NP is one and CTX is another. And those are looking at osteoclast and osteoblast activity. So the anabolic ones are basically saying, guys, wake up, you silly builders, and cool it with the resorptors, right? So with the class. So the blasts get turned on more than the class. So you're building bone back with the blast because you've woken them up again, and you are quieting down the class. So if you look at one of these medicines that you can be on there, daily injections or their, injections at certain intervals, the Tymlos and Forteo are daily injections for only up to about a year to a year and a half or two at the most. And then Evenity is a little bit different timing, and I can't remember exactly what it is, but we can look it up and put it in the chat. But the reality is that what are we doing? We really are trying to build bone back. The problem with a lot of these medicines is you have to have such a terrible bone density score for you to be eligible for doing them that it's sort of like, well, yeah, you're going to collapse into a heap by the time you actually are doing that. So we need a whole new idea of approaching building bone back with these medicines, and maybe shorter periods of time, or maybe ways to be able to deal with an osteopenia to actually try to get it to normal before you get to osteoporosis. So I think we have to start thinking creatively about how is it that we can get a football player back on the field after he has broken a femur in a year, and we can't get postmenopausal and perimenopausal women to have better bone for the next 50 years of their lives, which is half of their life.
100% agreement in that. And I'm so glad the work that you're doing is bringing more awareness to this, because not only from a local level that we're actually working with clients and patients one-to-one and being able to make these changes, but also from an infrastructure standpoint to be able to address this from a future basis. And I think that the current generation of perimenopause, menopausal, and postmenopausal women are certainly aware of that, and it's and doctors like you can actually continue to bring this up to the forefront. So I'm so thankful for the work that you do with this population. And yeah, I'm excited for the future, especially with the research that has shown the importance of building bone and the opportunity of building bone with exercise resistance training, and combining with all the therapeutics that you or pharmaceuticals that you've been able to bring to light. Dr. LaFollette, you made a change in your practice. Tell us a little bit more about what is going on in the practice, and for the listeners who are like, I have to start working with you, what's the best way?
Well, thank you for that, Ashley. So I started delivering babies in this county in the early 90s. I think it probably was the fall of 92, if you really want to know. And it occurred to me that after 34 years of delivering babies that, being up in the middle of the night isn't always great for your health. And God knows, you got to get, not only do you need to be awake at 3 a.m, but you have to be awake and on at 3 a.m. And so it became clear that maybe there was an idea that maybe I could continue to work in women's health and not lose so much sleep. So the pivot was that if I was going to stop obstetrics, in my view, still at the top of my game, I needed to have something that is going to keep me as interested and as focused on women's health as that field, the obstetrics part of my career, has. So I needed to learn more things about how women age and how we can continue to have a longer health span with better lifespan and health over time, particularly for women. So the premise, the title is called the Center for Women's Lifelong Health and Wellness. I think the way to look at it is I'm combining information from primary care, adding cardiology and cardiovascular health, because that's the one thing that kills women in the world, and then adding the bone components, having collaborative practice with me, with a cardiologist, with a endocrinologist, a bone density person, with a neurologist to help with sleep, with you in terms of exercise and how women can exercise well and safely, and then metabolic health with the GI people. So the idea that I can collaborate across specialties to bring the best care of each of those specialties to our lives as we move forward to avoid them. Now, look, there are things that can happen. You could get a cancer. You could have something that happens and you break your leg. That, from that moment on, we still need to move forward in terms of how are we going to keep your life as full and as functional as it can be. And so I'm not saying we can eliminate the next things that can happen to you, but we sure as heck can minimize things that we can predict will happen if we don't take care of them. And part of it is recognition in terms of bone health. Part of it is recognition in terms of cardiovascular health. I think for most women in this area, cardiovascular health has not been ignored. People have paid attention. They pay attention to their cholesterol, but do they pay attention to their functional health? How is their heart working? How are they pushing themselves? How are they exercising? I know most women never wanted to be in the gym and lift a weight, so I know that's a big miss in terms of bone health, right? And then the idea that exercise itself also, we know, is the best way to keep your head and your cognitive function. So if you look at cognitive function as basically a decline of mobility, they go hand in hand. So you need to move to keep your brain alive, to minimize brain fog, to make sure that you're able to do all the things you want to be doing in terms of your work as well as your life and your family. So this idea of literally prolonging the healthy part of our lives as long as we can, and then because we're all living 20 years older than our parents for the most part, but we're not living 20 years better. Let us live 20 years longer and better. And that takes everybody at the table.
100%. And with that being said, how do people get in touch with the clinic, with you?
You know, I would say that you can call Marin General and ask for what's called Women's Health and Lifelong Health and Wellness Center, and you will get to me. It isn't as easy as it sounds. There is ways in which, obviously, you can call and make the appointment. If you're already on my chart, you can request an appointment, but usually you need to actually be part of my team. So you got to get yourself into the team. So the easiest way to do it is the phone. It's not as easy as it should be. We're working out the kinks. It's only been 2 months. But no, I'm not going anywhere. I'm working. I'm in the same office I was at 599 Sir Francis Drake. I'm working Monday, Tuesday, Thursday, Friday, at least a Saturday a month, if not 2 Saturdays a month. So just know I'm available, but it takes a little bit of legwork to get there. But we'll make it easier as we go forward.
And listeners, I am obviously not Dr. LaFollette's target demographic. I'm not a patient of hers, but I just know how amazing she is and how brilliant she is. So if you are in the market or looking to be able to figure out how am I going to manage the next 50 plus years of my life, Dr. LaFollette is the person to go to. So I'm going to put that contact information into the show notes. And yeah, thank you so much, Lizellen. It's so good to see you.
Listen, right back at you. I'm delighted to be here. We have lots more to talk about, but this is a great collaboration moving forward. Thank you, 100%. Ashley.
Thank you so much for listening. It's been an honor being able to create these episodes for you. If you have any questions, you can always reach out to me at ashley@dragonphysicaltherapy.com. No patient-therapist relationship is formed by listening to this podcast. We are not providing medical advice, and all information should be confirmed by a medical provider.